In this video, I'm going to be talking about varicoceles. Now, varicocele is basically a varicose vein that occurs in the scrotum, which is basically the pouch that contains the testicles. And this can affect one's fertility, and it can also affect one's hormone health. And long term, it can have some pretty detrimental effects. Now, the point of me making this video is not to give you the bad news and the scary news, it's to give you the solutions. So there's not too much information out there on things that are clinically proven that are natural, safe, and effective that you can take immediately and start getting some relief. All you hear about is surgery, and that's kind of concerning to people. And so I wanted to share some information with you, and I think you'll find this quite useful. So let's get started. Firstly, what is a varicocele? This term varicocele refers to the occurrence of a varicose vein or varicose veins within the scrotum, which is the pouch of skin that contains the testicles. Now, this occurs due to poorly functioning valves within the veins, and long term it can lead to, well, actually immediately it can lead to decreased sperm production and quality, which can then affect your fertility. And long term, this can actually lead to testicular atrophy, which is basically shrinkage of the testicle or testicles. And that can actually have hormonal effects as well. Now, if this occurs in early life, it can actually result in the failure of the testicles to develop. Now, typically, this is not it's not usually a serious condition. However, it can affect your fertility. And while it is often symptomless, the most common treatment option for it is a surgery called a varicocelectomy. The downside to the surgery is one, it costs between $4,000 to $6,000, and two, it can often leave you with, depending on the type of surgery, it can leave you with a scar. And it's not always successful. Now, why do that when there's so many natural, clinically proven options that can actually help you for this? Well, that's the point of this video. Let's get to it. But first, let's talk about the symptoms. The most common thing associated with a varicocele is usually pain. But for the most part, there's no symptoms. Occasionally, a person may experience pain, and that can actually worsen with physical exertion. And when a person starts to feel pain more frequently, that can actually become a long-lasting thing. The most common problem associated with it is obviously going to be infertility. And in fact, most cases of varicoceles are diagnosed when a person is trying to have a child and they are unable to conceive. And then the man goes for his checkup and finds out, hey, he's got a varicocele, and that's reducing his fertility. And in that case, it needs to be treated if he wants to have children. The appearance of a varicose vein within the scrotum is another symptom. And if there is pain, it can actually be relieved upon lying down. Now, the vein can actually get enlarged from time to time, and then it can reduce in size as well. And on examination, it will appear as a bag of worms. It will look and feel like a bag of worms. What will happen is you'll typically get this diagnosed by a urologist. Those are the plumbers, and the plumbers of the human body. And so when you go to a urologist, they'll have you stand up, and they will palpate the scrotum, and that's when they will feel the sensation of a bag of worms. And if the veins are really, really enlarged, they'll actually be able to see it appearing as a varicose vein, which will also kind of look like the presence of worms. But it's not worms. Don't worry about that. That's just the way it looks and feels. So what can actually be done about it? Number one on this list is horse chestnut. Now, you may or may not have heard of this before. It's actually a very common herb used for treating varicose veins, but more so in the legs, issues with chronic venous insufficiency. That's actually what happens when those valves stop working within the veins. It's very commonly used for this, actually, and there's quite a few studies. It's been used for centuries for other conditions as well, like infections. And now, the key chemical constituent in it is not very bioavailable, so you need to consume it together with a bioavailability enhancer. But you should be using it under the supervision of a practitioner. So they'll explain that to you when you go to one. Now, what is the clinical research supporting this? Well, it's actually been found in a clinical trial that that by consuming horse chestnut, people who had varicocele-associated infertility had a considerable amount of improvement in their sperm quality. And as I said earlier, it's been used in various studies for varicose veins in general, which has pretty much the same pathogenesis, so a similar pathogenesis. Next on this list is an amino acid known as L-carnitine. And L-carnitine is, it's very well known in sports medicine. It's an amino acid. It comes from proteins, and its primary function is to like transport fatty acids into cells, and it gives you more energy. It's also great for weight loss, mild weight loss, and improving muscular function overall, also for certain brain disorders like autism, ADHD. But in the case of varicoceles, it's actually been used in a clinical trial for that and found to be very effective for improving the sperm counts, the motility, and the morphology, as well as the volume. And it was found to actually be just as effective as the outcome of a varicocelectomy. That's the surgery. So if you had to choose between L-carnitine versus the surgery, I think you would choose L-carnitine, given the fact that it's usually extremely affordable, like $20 for a bottle or less, and the surgeries can be up to $6,000. That's one reason. Another reason is having to have yourself cut open. Doing this first would be the better option, the safer option. Is worth a try. If this doesn't work, sure, go for the surgery. I'm not saying don't do the surgery. I'm certainly not saying don't do whatever your doctor recommends. But these are some things just for your information so that you are aware of it. The next one on this list is Gotu Kola. Now, you may have heard of this. It's very popular for its brain boosting benefits, and but it's also really good for your circulatory system. And it's been well studied for its medicinal properties and highly effective for treating varicose veins in general and the underlying problem, which is chronic venous insufficiency, as I mentioned earlier. Now, there haven't yet been any clinical trials specifically on varicoceles associated with this herb in any way, but it has been done on varicose veins in general. And this is generally a very effective herb. In fact, in my experience, depending how you use it, Gotu Kola can actually be more effective than horse chestnut for varicose veins. So that's another remedy. And the other one is butcher's broom. This is another medicinal herb. Same thing, just like Gotu Kola, very effective for treating chronic venous insufficiency and varicose veins, but not yet tested specifically for varicose veins. I'm sorry, for varicoceles. Varicoceles have been used in clinical, these two have been used in clinical trials for varicoceles. These have not yet, but they do help for varicose veins in general. So my advice would be to start with these. Of course, use it under the proper supervision to avoid any adverse effects. And yeah, that's my take on a few things that you can do for a varicocele and what can actually get you a considerable amount of relief. And I hope this information has helped you. If you'd like to get in touch with me, you can do so through my website, drnishal.com. I do online video call consultations, so no matter where you are in the world, you can get in touch with me and I can help you. And I'll see you in the next video.